Okay.
Okay, we're recording now.
Perfect. Hi everyone. This is Olivier. I'm proposing that we give a few minutes to give the time for people to join. So you're here for the UpDoug, the UAV for Payload Delivery Working Group webinar. We'll start in a couple minutes. Hi, for everyone who just joined. This is Olivier and Olivier Defar. We give it 1 more minute and then we'll start the webinar as the number of participants keep increasing. Just 1 more minute and we'll start. Great. Well, I suggest that we start. Can one person confirm that you can hear me and I'm just not alone? Can you hear me?
Yes.
Okay, great, great. Hi, everyone. My name is Olivier Defau. I am a senior manager in the health system group at Village Reach and also the co-founder of the UAV for payload delivery working group. I want to thank you for joining us today for an exciting webinar from Marga from FHI 360. But before we start the presentation, I want to give you first, I wanted to give you an update on UpDog. As you know, you heard Paul Wagner to coordinate this webinar roundtable discussion. Paul is unfortunately transitioning out of this role as he has accepted a full-time position elsewhere. So I'm taking back the role and responsibility of coordinating those events with the help of a colleague, Gabo, who is also joining us right now. I want to thank Paul. I don't know if he's on the line or not, but I want to thank Paul Wagner for his great work that he did over the last year and wish him all the best. Another update from the UpDog, from the working group is because of the size of the membership, we're about 230 members, and because of the intention of really making this working group more and more impactful, we decided to spin it off of Village Reach and have the working group being its own entity. And so with that, there are going to be some changes. Two important changes are, first one, next month in April, the UpDog will have its own website, so it wouldn't be hosted by Village Reach anymore. It will have its own website with its own repository, and so you will see that change coming your way next month, and it will, you'll have an official email and so on. But we're very, very excited to launch this UpDog website. The second change is that we are going to be changing the managerial structure of the working group. As some of you may know, this working group started about 3 years ago. It was a partnership between a couple consultant and Village Reach. Village Reach has held the fort for the last 2 years now alone, and with the working group becoming its own entity, we are gonna have a committee or an advisory board, an advisory committee who will help manage this working group. I think this is a very exciting change. To have multiple organization taking turns on managing this working group. You will see an email describing that into more detail, but also asking if some of you would be interested into contributing to the management of this working group. So more to come. But today we're extremely lucky to have Marga Ickley from FHI 360 present around a UAV drone delivery decision tool that her organization has been developing over the last few years. Marga is a researcher at FHI 360's Health Service Research Division. And she's about to present a tool that they have, and this tool, this decision tool, really intend to help government, healthcare professional, health program staff, stakeholder, consider if and where does drone may make sense to supplement an existing supply chain for distributing medical health supply. So without further ado, I'm going to pass the microphone to Marga. So if you have any question, please enter them into the chat. We will be monitoring, and depending on the timing and the topic of the relevance of your question, we may stop Marga or wait until the end. We have saved about 20-25 minutes for discussion. Yeah. So Marga, are you there? Hopefully.
I am.
Wonderful. Thank you, Marga, and the microphone is yours.
Okay. Thank you, Olivier. Thank you, Gabriella. Welcome, everybody. Thank you for joining this call. I am representing a team from FHI 360, and we're very excited to present our UAV delivery decision tool. This tool is still in draft form, and we're hoping to get your feedback to help improve it. We want it to be useful, and we want it to be used. So all feedback is welcome. However, we do have a very short deadline for funding, so we hope that feedback can be obtained today and within the next week so that we can make revisions before our funding runs out. So I'd like to begin with a story. In 2015, 79 brand new emergency medical vehicles were sitting idle in Mpumalanga, South Africa, while citizens of this province and neighboring provinces were dying, waiting for ambulances to arrive. And this situation was really sad because there the technology was available, but there was no funding or capacity to hire the 300 personnel, drivers and maintenance workers needed to operate them. Not enough of the vehicles were 4x4 capable, so they couldn't handle the terrain. And insecurity was so bad in some areas that these vehicles had to wait for police escorts. So I wanted to bring up this example because it's an example of having the technology that we know works, and yet still not being able to help the people that were intended to be served by them. I bring this up because we all know that drone delivery is possible, and we're all really excited about it. But there are so many other factors besides the technology that are important for making this work within the health care system. I come from a health services research approach. That means I think a lot more about health services and health systems than I do about drones. And I'm not a supply chain expert, so I'm very excited to have the input from several of you who I know are supply chain experts on this tool as well. So we know that drone delivery is possible, but the question we sort of had was, is it feasible? And how do we help program staff and governments understand when it makes sense? A lot of times when we talk to our program staff about whether they want to use drones to deliver medical supplies wherever they are, they'll say, yes, and we want Zipline. And that's great. We're thrilled about their enthusiasm and that they know about Zipline. But when we start asking, okay, what would you like to deliver? They say, oh, well, we need to transport laboratory supplies from the health facilities to the laboratory, and then we need to take the paper records back. And I say, okay, well, I don't think Zipline's probably the right tool for you, the right device that you would want to use, because they only deliver in one direction. And sounds like you need something that lands in two places. So we realized that there was sort of this lack of understanding on the part of program staff and government staff on what information they even need to consider when thinking about drones and how they need to actually develop a use case. And in addition, how can they think about the impact that drones would have on the larger health system in making this decision. And although it may seem premature to think about health system integration when we're still pilot testing the technology, I would argue that it's precisely the time to start thinking about it so that the technology can be designed and the program implementation can be designed for eventual scale. So our objective was to help governments, programs, and medical professionals assess whether UAVs, specifically for medical delivery, make sense within their health system context. And we decided that creating a tool would be the best way to do this. So our tool sort of has 4 objectives. The first one is to make sure that the problem that the stakeholder is trying to solve is something that UAVs might be able to address. So we go through defining the problem and understanding the root causes. And then helping them develop the use case, how they want to fly the drone, where, how many times they think it needs to go, where is it landing, where is it taking off, and what kind of other constraints they have. And then the 3rd section is about identifying relevant stakeholders. And the 4th one is about helping them understand where they might try to implement this technology or a program based on health system strength, under the assumption that you'd probably want to start implementation in areas that are more likely to succeed, in the easier places first, and then extend to other areas. We made a couple decisions about how we wanted this tool to operate. We decided we were only going to address delivery. The scope was it was beyond our scope to talk about using UAVs for visualization or other purposes. So this tool is very specific to delivery and delivery of medical goods. And we use the term medical goods broadly. That includes commodities like drugs, vaccines, also laboratory samples, and test results. And it's actually interesting, when we talk to a lot of programs, a lot of them want to carry paper test results back to health facilities, which was very surprising to us in this internet age, but that's one of the needs we've heard. We also wanted to make sure that the tool was going to be very simple and very easy to complete for our intended audience. And we want it to be used, so we also tried to make it relatively short and sweet. So today I'm going to talk through some of the components of the tool and then solicit your feedback. I'm open to all sorts of feedback, but I also have some targeted questions if we have time to address those. So like Olivier said, please feel free to enter comments, questions into the chat box and stop me if you need to. The intended audience for this tool are really people who are coming from the health perspective, people who are in the government, program officers, or health professionals who are tasked with understanding whether UAVs are a feasible option. So maybe a minister of health tasks somebody to figure this out. And so we would expect it's that person who might start with this tool. We assume that our audience is fairly naive about UAVs. They haven't explored this extensively. And we also made the assumption that people coming from the health perspective are going to have a very particular thing they want to transport in mind, rather than thinking about everything they could transport at once. I think all of us have seen in the literature and in the projects that have been presented on UpDog in the past, UAVs are going to be most useful when they're carrying more than one good. But on the other hand, a lot of the funding that exists in the health sector is very targeted to a specific medicine or a specific disease. So That's an assumption we made, is that most of the people using this tool are going to start thinking about a very specific thing they want to transport, or a very specific disease that has specific treatment that they're trying to deliver. Okay. And we expect this to be used very early in their process of figuring out whether this makes sense or not. And we sort of developed the tool to be kind of like a choose your own adventure. You can complete it many times and change what you input and see how that affects what you see. I don't know if all of you are old enough to remember the choose your own adventure books, but I always liked them. So without further ado, let's look at the tool. So I've provided this in screenshots. We can move to the actual tool if I don't know what is easier for people to look at, but let's keep it within PowerPoint for now, and we might switch over to the actual tool later. You can see the address for the tool down here at the bottom. It was developed in Shiny Apps, which is an open source R-based technology. And so you go to this website, and here's the introduction to the tool. The landing page gives a very brief introduction to sort of the goals we have for the tool. We're hoping that users learn the parameters of using UAVs for transport, can define a use case, and be able to communicate it if they put out an RFP or something for a UAV operator. It would include all the information they might want to use to start a realistic conversation with UAV operators. And then it helps them conduct a stakeholder assessment and select sites for implementation. It also is very clear that we're not trying to tell you what UAV to use, how much it's going to cost, because we recognize that that's going to change a lot over time. So we wanted to stay away from that completely. So there's a couple tabs across the top. The first one's the introduction, then there's the how to use, terms, and then take the assessment is where you actually complete the online part of the tool. And then we're going to have an acknowledgements page, which I don't think actually has anything in it yet. So the how to use the tool is fairly self-explanatory. I'm not going to spend much time on that, except to say that there are 4 parts to the tool. And the first 2 parts involve an online survey. And then the other 2 parts are downloaded into a Word document. We're trying to streamline that a little bit, but we were having a little difficulty getting that all into one process. But we're going to see if we can fix that in the future. So here's the take the assessment page. And so here we have part 1, which has a little synopsis, and then you click on this blue button to complete part 1, and then there's a little status bar. And the status bar is there because you need to complete both parts 1 and 2 to be able to view the results. So this helps the user track whether they've completed both parts. And then down here in the bottom right corner is a button to generate the report. So what you do is you take the online survey in parts 1 and 2, and then your answers are used to populate a report document. And that's what you get when you hit generate report. And that provides the use case description and also some guidance about the decisions you made and the impact that has on how operations might be conducted.
Excuse me, Marga. I think we're having a technical issue. Somebody cannot hear anything. Stefan, actually, I can hear you. Gabo, can you hear Marga?
Yes, I can.
Okay. So you may want to restart, log out, and log back in, Stefan, because I don't think anybody else has that issue. So that might be just specific to your device. Sorry about that, Marga. Go ahead.
It's quite all right. So the other thing down in the right-hand corner I'd like to point out is the blue text that says download parts 3 and 4. Again, that downloads a separate Word document to do the stakeholder assessment and the site selection. We're trying to include that into the generate report, but right now they're separate. So let's take a look at part one. So part one just has two questions. And the first one is sort of like, what's the issue you're trying to address? Why are you even considering UAVs for transport? And we came up with a lot of things to put into this question, but we're trying to narrow it down a little bit to help not make the tool so long. And we have options like reduce stockouts, improve response time, ensure biomedical supplies are valid when they get to the laboratory. So we're trying to think of the problems that health care professionals and implementers deal with on a day-to-day basis. You know, they have these standards they have to meet, these targets they have to meet. What's inhibiting them meeting those targets? And then you see there's a none of these box. If you check that box, you get a note that says, oh, interesting, we really haven't thought about this. Contact us. Maybe we're missing something, maybe we should include it in there, or it's possible that UAV transport isn't really going to solve your problem. So if somebody checked that by mistake, they could dismiss this and uncheck none of these and then check something else. The same is true for the next question, which is what are the barriers you're encountering? Is it distance? Is it speed of road travel? Is fuel not available? We have a variety of options here. Again, if you can't check any of the boxes that appear and you check none of these, you get a message saying, it's possible that UAVs are not going to be a solution to your situation. And the reason we did this is that we're trying to help users understand what kind of situations UAVs might help with and when they're wasting their time. One of the points of feedback I'm really interested in is what we're missing here. I mean, obviously we don't want to miss any key items in these lists because we want to make sure that we're not keeping somebody from exploring UAVs for a situation that might be useful. So we'd really like feedback on these lists. Part two is about defining the use case. I think most of the folks on this call understand what's meant by use case. And so let's just move forward. And so the first question in defining the use case has a lot of text on it, but it's sort of a critical component that directs all further questions in the tool. So we're asking, in what direction are you transporting things? And so the first diagram is really you're going from one type of location to another type of location, and you're only transporting something in one direction. The second example, you're transporting one thing in one direction and another thing in the opposite direction, but the two types of sites you're going between are the same. And then the third one is you're transporting one thing from site 1 to site 2 and another thing from site 2 to a third site. And so we added this one because when we talk to our program staff, a lot of times they're saying, well, we need help getting drugs from a warehouse to a health facility, and then the health facility needs to submit laboratory samples to a laboratory, and that's in a third location. And so really they're talking about a different kind of transport than just between two sites. So there's a lot of text here, and this is one of the areas we're also very interested in feedback on, whether this is clear, and especially for those of you that think about supply chains a lot. You know, is this too simplistic? Is this too confusing? So keep that in mind when you're providing feedback. So once a use case is selected, you get several questions. What are site 1s, what are site 2s, and how many are there? The options for the different sites include warehouses, hospitals, health facilities, pharmacies, laboratories, community sites, and households. And then if you have a site 2 or a site 3, we also include an yet undetermined location. And we were trying to account for a use case where somebody's trying to get an emergency medicine to somebody who we don't know where they are until they call the drone, right? So I know that still sort of regulatory wise is still very far in the future, but we wanted to account for that possibility in the tool. The next questions are about roughly how many packages need to go and how frequently. Are there temperature limits? What's the terrain like? What kind of weather do you encounter? There's a lot of different questions in this section. I'm not going to go through each one, but it's generally to get a sense of the context of flights. So that's the end of parts 1 and 2. So, oops, sorry, that's my timesheet. So after you've completed parts 1 and 2, then you can come down to this button and hit Generate Report. And when you click on that button, you receive a Word document that looks like this. Can somebody tell me if they can see this?
Yes, we can.
Great, thank you. Okay, so this is the document that is created given the responses to those questions. And so it gives just a summary of what the overall objective was that was chosen in the first question, and then what challenges were selected. And this one I just clicked through, so if you read too carefully, it might not make sense. And then it shows the use case that you defined, and it tells you, okay, you're trying to transport goods from 2 to 5 hospitals to 26 to 100 lower level health facilities. You're only carrying goods to the health facility, and the return flight is going to be empty. So that's the summary, and then we add a little interpretation of that. So we say, well, one-way transport is less complex than two-way. On the other hand, you might consider that it's less cost effective if you're flying empty. So think about maybe there's something you want to transport from site 2 back to site 1. We make mention that you could use a UAV that lands or that just drops supplies. That landing includes some increased risk. And we're not trying to be very comprehensive here in terms of all the details. We're just trying to give our users a sense of the things that are important to the UAV operator to consider, or things that are important to them in choosing what kind of UAV operators they're looking for, whether it's a hybrid, whether it's a fixed wing. We have a section on flight paths that does not vary depending on what your choices were. We have a section on distance and payload that just summarizes what they used or what they inputted, and then talks about the trade-off between distance and payload. We have a section about securing the landing area. That does not change depending on answers. It's just giving them a sense of what they need to think about if the UAV needs to land. A little bit about geography and weather, security concerns, regulations. We took a very hands-off approach to the regulations section and directed users to go to the Drone Regulations Database or the Drone Operations Toolkit, which are nice resources about regulations. Financing, we also provide references to some cost effectiveness studies and just give some bullet points about the steps to go through when thinking about cost effectiveness, and a link to JSI's cost simulation tool. So that's sort of, those are the bones of the output that's generated from parts 1 and 2. Then there's the download parts 3 and 4, and I'll just show you briefly what those look like. Part 3 is the stakeholder mapping. So basically it asks users to think about who needs to be involved in decision making. And we encourage them to think about regulatory bodies, healthcare workers, laboratory staff, working groups, UAV operators, funders, neighboring communities, and neighboring countries if flights are going to be near borders. And again, we provide some resources to more formal stakeholder analysis tools. But we also have a very simplified tool that's provided here, and there's instructions for how to do it. But basically, you list the stakeholders, you estimate whether you think they're supportive or unsupportive or neutral. You think about the impact that UAV transport's going to have on them, and whether that impact is likely to be positive and negative. And this is just a tool to help users think about how they need to engage with different players and sort of where they stand with different players that will help them plan their approach for gathering support. Lastly, part 4 is about selecting sites. And this process encourages the user to think about need. So we don't know what the need is at this point for whatever use case they're developing, but most health programs will say, if this is a program to strengthen malaria, our need is to meet the targets of the number of women who get malaria prevention during pregnancy. And so the areas of greatest need for them might be facilities with the lowest level of stock, or the worst, most frequent stockouts of that medicine. So they would go through and they would list those facilities in order of need. Then they would think about how much needs to be transported. And then they would do a really quick assessment of how well that health facility functions. So they'd evaluate human resource capacity, evaluate supervision, how well operations work there, meaning how good is the data that they collect in general. And our idea for that is if they're not doing a very good job reporting or keeping track of what's going on, maybe they're not a great place to start drone operations, because you probably want to start somewhere where all the T's are going to be crossed and the I's are going to be dotted. You want to start in a place where you know that all your protocols are going to be followed. And lastly, it gives you instructions for creating a little score and then analyzing the sites. So there's a lot of detail here. I don't want to get too much into this unless people have very specific questions or feedback about it. But I want to have lots of time for conversation. So that's, I think, the end of what I had prepared. So I'd like to open it up at this point to anybody's spontaneous feedback. And if we get crickets, I can also ask some targeted questions.
Thank you, Marga. Thank you. So, yeah, so if people have questions, just unmute yourself and go ahead. We don't have any question in the chat. Maybe I can just start the step 3 and 4. What you just talked about, evaluating HR supervision and so on. Is that an offline? So you say you evaluate this and that, and I think I saw a spreadsheet or some kind of a document. So that part is totally offline. So. Or not? I was not sure I understood that part.
Yeah, sorry. No, parts 3 and 4 are intended to be completed offline. And our rationale for that was that we thought it might take a little more time to complete those aspects, and the user might want to involve other people in the conversation. So we didn't want their web session hanging. So we have that as a separate tool. Eventually, if we got more funding, we might find a way to incorporate that into an online portion as well, but not at this time.
I see. So it's more like a guideline of the things that people need to think about and ask themselves or ask the relevant folks
Exactly.
to answer the question. Okay, thank you. Thank you.
I've got a question.
Go ahead.
Yeah, Ian Murray here. What will be done with all the data? Will it be collected back in a centralized place to try to get trends, or is it going to be totally decentralized and just left with the individual users?
That's a great question. As we are researchers, we would love to have gotten responses and to synthesize them in some way. However, we thought that people might be less willing to use the tool if they thought it was being collected that way. So ultimately, we decided to really just produce this tool and put it in the hands of the users. So they're welcome to share feedback with us, and we provide an email address in the tool for them to do so if they wish. But really, the only information we collect is what Google Analytics will give us about where people are logging in from and how many times. So we will not receive any of the information that's entered into the tool. I'm open to your thoughts on whether that's a good idea or not a good idea.
Maybe you could give an option. Maybe you can give an option that could be part of the part one as a part of the entry. Are you willing to share or not? In function of that answered, then the follow-up is adapted. Go ahead, Ian. Sorry, I didn't mean to interrupt you.
Well, I think, yeah, you definitely were hitting what I was just about to suggest is, yeah, make it as easy as possible for the user to participate in future developments of the tool. And if they know that it can be helpful, that could potentially come back and help them in the long run, they're more likely to participate.
That's a great observation. Thank you.
Hi, Marga. This is Eric from Linden. Can you hear me?
Yes.
I think this is a great tool. You mentioned the end of your contract and also getting it into the hands of users. How do you, what is the kind of next, if you can sketch out what the next phase looks like and how that happens, I'd be really interested in, is there another contract that's taking the place of that does that? And is FHI doing that?
We do not currently have a follow-on project. We're open to funding opportunities. We have some potential for using this tool within one of our programs, but that hasn't been solidified yet. So I can't discuss that yet, but we're hoping to be able to use it within FHI 360 programs to help our teams better provide services. We're hoping that you share it with colleagues and people who are interested in exploring this. And we'd love to hear if you wind up doing that, how it goes. And we're hoping to distribute it through blogs and through a publication.
Great, thank you.
So we have 3 question/comment. The first one is from Sarah De La Rosa from the Anterior Supagent Agency. Hi, Marga, great tool, and at quick first sight, it does seem well described and easy to run. My question, have any government, Ministry of Health partner already worked with this tool? That's the question.
So we had some giving input into the development of the tool, but we have not yet received feedback from them on the current version. If anybody that we know of, not yet. We haven't received any feedback yet. If anybody has a few targeted individuals they think might be able to provide good feedback on this tool, we'd be happy to talk about sharing this version with them.
And I think this is a good opportunity also to, if an implementing partner or government is looking for this kind of tool, I mean, they can directly reach out to you, or we can put you in contact with them if they reach through the UpDev group as a user, a direct user of that tool. So we'll make sure that if that happens, we'll forward all communication. Second one is from Diego Morales from NextWing. It's a UAV provider. Do we feel supply chain management entities understand all of the flight capabilities of newer drones, and should that be further illustrated in the tool?
Great. So no, I don't think users of this tool understand the capabilities of UAVs. And I think we were trying to avoid getting into the situation of saying things in the tool like, UAVs can only fly round trip 100 kilometers with a payload of 2 kilograms, because we know that's changing. We know that every day there's new technology that's coming out. So we really struggled with how to help users define what they needed without limiting their vision, but also make it kind of realistic. And we are open to some suggestions for text that we could put into the output document about that. Because I don't want the tool to be irrelevant in another 6 months. On the other hand, when I had some reviewers go through the tool, they were putting in distances of 300 kilometers and carrying a payload of 10 kilograms. And you know, so I'm open to suggestions about whether we as a community think it's a good idea to say right now, as of March 2019, think, you know, this is kind of where the technology is, or if we should keep that out of it.
And I understand you struggle. The way I compare it is like shooting at a moving target. And I use that expression a lot when I talk to lay audience, because the technology is evolving so rapidly. And it's like you have a use case, but now the use case can evolve because the technology has evolved. And so when I was listening to you and around the assessment question, the use case characterization, I think those will evolve over time based on the technology. So a question that I had in my mind was like, what is the process? Are you guys gonna be updating these tools, adapting it based on one of the factor is the drone technology evolving? So is there some kind of support for this tool that you will be providing, or FHI 360, to make sure that this tool evolve as well?
Yeah, I think that's a great point, and we will certainly advocate for that. We're hoping to be able to do that. We don't have any funding secured for it at the moment, but we'd like to be able to have the tool advance with the technology. On the other hand, we think of this as a first run tool, so it's something that maybe for UAV manufacturers or operators, it could be helpful just in that it gives people from the health perspective a way to start communicating with you, to open the conversation and say, oh, this is actually what we want to do. We want to fly about this far with this much payload. Do you have something that can do that? And so it sort of opens the conversation with the manufacturers and the operators to talk about what their technology can do. But it sort of provides the health side with some way to even know what the UAV manufacturers and operators need to know about their use case. Because when I talk to UAV operators or, you know, and about our role, they say, well, what are the use cases in health? And I say, well, they're really dependent on a very specific situation. So this is sort of our attempt to help the health program people define their use case in a way that's well understood by the UAV operators and manufacturers. And let me know if it doesn't do that, because I'm happy to adapt it to have it better serve the information needs that you have.
Thank you, Marga. Other question from Geoff. What does the compendium of stakeholders look like, and how is it being used? Is there any link between users and solution providers?
So I'm not sure I understand the last part of the question. The stakeholder tool is intended to help help the users understand the players they need to engage with, and who's likely to be supportive and not supportive, and then developing strategies to engage all, especially the unsupportive ones. Can you unmute and rephrase the question a little bit, Jeff?
I can unmute you, Jeff, but I want to make sure that you prepare to answer it. Okay, let's hold on that one. I'm going to try to reach or give a minute to Jeff to unmute and come back. Matiko from JSI is asking, or is actually giving I think a really good good advice, is that you may want to consider adding in the situation assessment whether UAV will complement other modes of transportation that are being used or not, and the other is if proof of delivery is important, so that the UAV operator can come up with a solution for that. So there's two questions. One comment, well, actually two comment, is about adding into your UAV assessment, situation assessment, if the drone is complementing an existing or not mode of transportation, and if proof of delivery is critical. Any comment on that one, Marga?
Matiko, thanks for those. They're great points. I guess I have a question for those of you that are supply chain experts. In terms of thinking about the way the drones are going to fly and incorporate with the supply chain, is that conversation about whether the UAVs are complementing versus substituting something that you would want to run your models on to make the decision? And is that typically something you help stakeholders decide, or do they typically come to you and say, I want it only to complement the supply chain, or I want it only to substitute the supply chain? How do those conversations typically go?
Matiko, feel free to respond directly after unmuting. Here we go.
That question is critical in terms of how do you integrate some of the logistics data, and for this case, like a proof of delivery for some of their government commodities, although they are donated or it's a donor-funded program, but sometimes government and programs usually likes to have that visibility of data and the proof, like this amount of commodity were delivered. And since you are talking like this should be a service, a program should be using this as a service from UAV operators. So sometimes that become very critical, and operators are required to be able to come up with a solution to prove that deliveries were made. So going back to the issue of whether the UAV or UAS will be operating separately or complementing to other, is to make sure how are you going to integrate that? Because if UAV will be complementing the existing mode, that means there'll be certain portion or some commodities will be delivered by UAV, some being delivered routinely by other mode of transport. So how do you be integrating that and ensure that logistics data or supply chain data are being captured and there is that visibility across? So from higher level, they can still see and track all those. So sometimes that becomes important to understand.
Thank you very much, Matiko.
And I'd like to maybe complement that, and I see you'll see in the chat after, like Judith from UNICEF, Ian, definitely said to definitely complementing an existing, and I tend to agree with that. Usually people think about drone replacing an existing mode of transportation because they don't necessarily understand that what we're trying to do is it's a system change level and the implication that will require it, and changing, replacing truck or motorcycle in any cases by drone is quite unrealistic. So there's a lot of education and sensitization to do in that regard. So most of the time, once after understanding better the use cases, they start understanding, oh, okay, it's really a complementation of an additional model of transportation and not a replacement usually. So Geoff, you want to go ahead? I think you're ready to answer it. Maybe, Geoff, yeah, you unmute, but we cannot hear you right now.
Can you hear me now?
Now we can.
Yes. Okay, fantastic. Thank you. So Margaret, thank you for answering the question. And my real question is, how is the compendium of stakeholders comprised? Is it private solutions providers or donor agencies? And I think you said the tool doesn't necessarily link in one direction or the other, but say vertical takeoff and landing or fixed wing would be the most appropriate solution. Are these providers, are they kind of, I guess, whittled down or you know, filed in such a way that users can easily find the best option for them?
Thanks for clarifying, Geoff. We're not providing a list of stakeholders for the user. We're giving them broad categories of groups to consider, but we're leaving the research up to them. They know their context best, and I think what you're getting at is that in terms of identifying UAV operators, how are they going to find them? And that's a really important question that I hadn't actually thought about yet. If there is a compendium or some place where that information exists, I'd be happy to put it as a link into the document. But we're not prepared to offer a list, especially because we don't know where people are going to be using this tool in what countries, and every day there's new operators popping up. So I'm open to recommendations if there's some registry you think we should link to or something for that to provide some ideas as they're going through the stakeholder involvement tool.
Okay, that's great. Thank you for answering.
Thank you. I just want to be sensitive at the time. We have 1 minute left. So I wanted to properly say thank you to Marga and team. This was very interesting. Thank you for all the questions. If you have more questions, just send them by email, and we will forward them to Marga. And the one question I see left from Sarah said, do you plan to collect and share within the tool a list of frequent Q&A based on the feedback you will be receiving over time? I think that's a great suggestion from Sarah.
Sure, we will consider adding that. Thank you.
Thank you so much, Marga. Oh, sorry.
Well, I just wanted to say thank you all for your participation. This is really helpful. And yes, please feel free to email me, or you can always email uav@fhi360.org.
Thank you, Mark. Well done.
Thank you, everyone.
Thank you. Bye.
Thanks, Marga. I just sent one last question, whether I can link your tool to our website, or is that something you wish to keep, receive feedback offline first?
That would be fantastic. I'd like to finish all updates maybe by the end of next week. I'd be willing to share it on your website.
Perfect. Okay, we can keep in touch separately.
Okay, yeah, and I'm sorry, I don't see any of the question or comments, so please reach out to me if I think that's Sarah. Is that Sarah?
Yeah, this is Sarah, sorry.
Okay, great. Thank you.
Thank you. Have a good day, everyone.
Thanks, you too.
Thank you, everyone.
Thank you.
Marga, this is Gabo. I'll go ahead and save all the chat questions and send them to you in a text file also.
Oh, that would be fantastic. Thank you.
Yeah.
All right. Thank you very much for organizing this. It was wonderful.
Good job, Margaret. Very, very interesting. And if we get any question, or we will pass it your way definitely.
Thank you so much.
Yes, thank you. It was wonderful.
Thanks.
Yep, and
Have a
also,
good day.
we'll send out an email to Updog with just a follow-up with the recording as well. So I'll link to the UAV at FHI360 email address for any other follow-ups or feedbacks there.
Perfect. Thank you.
Great. All right. Thank you so much.
Okay, thanks. Take care.
You too.
Bye.
Bye.
It'll tell you what you do.